Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board certified plastic surgeons.
Now I'm an independent patient coordinator who doesn't work for any surgeon. This means I have unbiased reviews for hundreds of doctors and I can help you achieve the look of your dreams, whether that's a supernatural or a video vixen. I use my professional and personal plastic surgery experience to help you look and feel your best.
Join in on the fun as I talk to plastic surgery experts, friends, and real-life patients about all things plastic surgery. Should be fun.
Hello.
Hi.
So how are you doing?
Let's see. I'm doing good. How are you? I'm excited to have you on.
Oh, thank you. I'm so excited that you are having me on. Thank you. It's good to finally reconnect with you.
Yeah, it's been a busy time. Busy time,
I bet.
And so many things have been happening recently. I think one of the things that we really can't pass by without talking about is what happened at the border.
Oh, with the people getting kidnapped and everything.
Yeah. And did you hear it turned out that they were going across to have surgery?
Oh, I didn't hear that.
They were
I've been
going across
operating
to
all day,
have
so
they were going across the border to have surgery and got kidnapped the day she was supposed to go in for surgery.
that is so sad.
Yeah, so it turns out she was going across the border to have surgery, and it just makes me so sad and kind of motivates me even more to continue to do what I'm doing. So I'm super excited to have you on, and I can't wait to kind of showcase you, talk about you, what are your favorite procedures, what are you up to? But before any of that, my first question is, why did you decide to be a plastic surgeon?
Wow. It's kind of complex. I love helping people. I love working with my hands. I love solving problems. And, now it's like I've got my niche, in aesthetic plastic surgery, but I knew I wanted to be a surgeon when I was in medical school. And my mentors always told me, if you can find a way to practice medicine without surgery, do it. But for me, it's like it wasn't an option. And as I was going through different things that I liked trauma, I liked pediatric surgery, I love general surgery. But the thing about plastics was that I love the idea of solving problems. I love that very few things are emergencies. So I get to go home, sleep on it, maybe call a friend or two, run some ideas by them. So I love that autonomy part of it where I can pre-plan things. There's few emergencies. And then, now that I look back, I actually originally wanted to be a cardiac surgeon. I then look at how the world is playing out with the politics of hospitals and insurance reimbursements and everything. It is nice that I have the cash option with stuff in the med spa or cosmetic surgery. So it really gives me a chance to, not have to be in the emergency rooms at night and be a family man, because I'm not as young as I was when I was doing trauma surgery and stuff when I was younger, and it also gives me a chance to plan and be my best for my patients. And also it allows me to practice medicine and not feel like I'm getting cheated on what I should be getting reimbursed, So
Yeah.
it's really worked out. I got lucky, I made good decisions, along the way.
I always love hearing the answers. I always love hearing the answer to that because it's always ranging from problem solving, or I always hear that you guys like to figure things out. How do I fix this? And I hear it often. So this is awesome. The other thing I wanted to know was, what is the procedure you're doing the most right now?
So my practice has always flourished with breast surgeries. I really marketed myself with breast surgery right off the bat. I was trained by one of the best people in the world, and it was a place I felt very confident in. But also, I feel like breast surgery is like the gateway drug to all of plastic surgery. It's not taboo to say I got my boobs done, but labiaplasty is not something people go around telling their friends about at a party. So I started with breast surgery, and the neat thing is, even the shyest person is going to go show one of their friends what they got done, and then that person is going to go and tell 10 other people, "Oh my God, you won't believe what Susie did. She got her boobs done. They look great." And then, it turns out 1 out of 5 women think about their breasts, but those 10 people go and tell another 10 people. So all of a sudden, one surgery leads to 1,000 leads, And then if you do a good job, then it's great. And then on top of that, then people feel more confident. Their, lives at home or on their personal side get better. They get pregnant, they get married, their mother-in-law wants a facelift. After they're done having kids, they want a mommy makeover. So it's just like the gift that keeps on giving. I actually used to do when I was younger and my practice was a little bit newer. I was getting a lot more of the straightforward breast augmentations with the young gals that want to go to college and make friends. Now I'm getting people that they've had 4 or 5 surgeries before. No one's gotten it right. And they want me to do something really complex. And I mean, and I love it, but like the stakes are higher, it's less predictable. And I've just had to do so many things to, basically like try to make sure they get the result they're looking for, because I don't want to disappoint them for the 5th time or whatever.
What are some things in your toolbox that you want to talk about for breast revision? Is probably up there, right there with tummy tuck revision and lipo revision of how popular they are. So what are some tricks that you have in your toolbox?
Well, I think it all starts with pocket control. If you're doing someone's like first breast augmentation, you want to make sure you measure like the footprint of their breast, and you want to place an implant that fits their chest but also meets their goals, right? You can always go bigger, have a higher profile so they get more upper pole volume, or go the other direction. They're looking for a more modest look. But what you do is you want to have good pocket control. Now, let's say they've already had a breast augmentation and didn't go well. The pocket's loose, you can tighten it using capsulorrhaphy techniques or a neo-subpectoral pocket, which is where you use the scar tissue to create new boundaries. And then, if the pocket's tight, then you can always do capsulotomy. That's where like you have scar tissue and you loosen it to create more space. So those are all things that we've been doing forever. So with the breast, it's really nice. You can always like add more or take away more, and you can do so. Tummy tuck revisions are tough because if they don't have more skin, then you're kind of stuck giving them an ugly scar. Or BBL revisions are tough because if they don't have any more fat, you can't do much more. So I think with the breast, it's really neat. Like there's a lot you can do, but the problem is when they've had multiple surgeries, they have less predictable blood supply with the scar tissue and everything. And if you have to do a lift, there's more risk of like, maybe killing a nipple, that kind of stuff. But I practice safe techniques. And then what's really set me apart lately is I really am a big fan of soft tissue support. So I've been using this mesh called Durazorb mesh. I used to use Galaflex, which is also a great product, but I just love the way polydioxanone, which is the material that's used in Durazorb, works. It's a biostimulator. It helps to form collagen. It doesn't last a long, long time, so it can't cause you problems like infections or extrusions, but it's there long enough to let everything heal while you're swollen and everything wants to rip apart, and it kind of holds it in place and lets it scar in the right place. So we recently actually just in the Aesthetic Surgery Journal had the world's largest series of breast revision surgeries with mesh published, and it was a series of 104 patients, and like 60% of them also got a lift, 40% didn't, and about 40% of our patients had somewhere between 2 to 6 prior surgeries, and the majority went up in size, like 200 cc's in volume. So it's not like we went from a harder to an easier case. We went from people who like already didn't have what they wanted and they wanted to go bigger and put more pressure on the soft tissue. So
this is awesome. I'm so happy that you're touching on this, because if I would love for you to elaborate on how this mesh works, what it does, how long it stays in the body, like teach us.
Yeah, so there's different materials that are out there for mesh. The original meshes that we were using were biologic meshes, which come from, like, for example, like a dead human or a dead pig. You remove the skin, you get rid of the outer layers, and you get rid of the cellular components, and then it's a matrix for your body to form. Problem is, like, skin stretches, so if it came from the skin, over time it stretches, doesn't hold, but it's great to give you extra tissue. But it causes a lot of inflammation because it's biologic. You have to use drains, and they're very expensive. And the FDA doesn't like us, using biologic things as much because it's more regulatory stuff. So then there was a mesh that came out that was made of silk, which was awesome because it was soft, but the silk would never get absorbed. And sometimes in thin people, it would like work its way through the skin like a splinter. So that wasn't cool. And I never used that mesh, but so people kind of got away from meshes. And then Galaflex came out, which is a material called P4HB, which is kind of like the absorbable sutures we use, but it's a little stiff, which is good because you think something that's stiff is going to hold things in place. But the problem is, like, someone's breast may have a particular shape or the implant has a certain shape. And if you've got this stiff thing in there that lasts a long time, it kind of creates it can create a dent if you pull it like too hard one way or the other. So it wasn't very user friendly, but I loved the product. I think it was great. I had amazing results. I never thought I would use anything else because I thought, hey, this is great as a backup. Durasorb is made of polydioxanone, which is the same exact material as a very popular suture we use in plastic surgery. It's absorbable. It really lasts about 4 months. And when you think about it, collagen formation in a wound starts at 21 days. And then the initial collagen you get is called fetal collagen. And then it starts turning into adult collagen in about 3 months. So once you've got all the collagen you need, this matrix starts to get absorbed and actually form a thicker layer. But what I love about it, it's very malleable. It's really strong, but it like you can stretch it or pull it one way or the other, and it stays where you put it. So it's kind of like carbon fiber versus aluminum. It's more flexible. You're like, there's no way it's stronger, but it is. And so I just love it because it gives me the best of all worlds. It gives me the control I need when I need it, but it's not there long enough to cause problems.
What kind of cases would you use it? So
all my cases now. I use it in all my breast cases.
Nice.
Yeah, because the thing is like, I've learned this kind of the hard way, and this is something where it's a paradigm shift in what we're doing. And again, I'm the first person to adopt this, but I think other people are coming around. If you look at a woman and like, let's say they just get pregnant and they get a little bit of milk that comes in, and after they have their baby and their milk's gone, the skin already got stretched out, right? Like, it's not like they have pounds of milk. They have a little bit of milk comes in, the breast stretch, and then when the milk goes away, the skin is damaged, right? Breast skin is weak, okay? Breast skin, you can't trust it. So if someone's skin goes through all those changes just with a pregnancy, do we expect them to be able to hold like a saline or a silicone implant that's 500 cc's for 10 years? Not really. So it stretches. So that's one thing. Number two, when you look at people as closely as I do, everyone's got asymmetry. Each half of the body is different than the other half. The ribs are shaped different on one side. One fold is higher or lower than the other. And so traditionally I've put in implants and then I'm locking down my fold, which means I'm putting in deep, big sutures. But a suture is like a string that looks like this. But if I have a mesh, it's like a sheet that holds it. And so my analogy is this. When I was younger, we used to not wear seatbelts when we'd be in the car. But then like when my dad would drive crazy, we'd like put the seatbelt on. I was like, oh my God, if we crash, like hopefully this thing holds me in. But the reality is now we wear a seatbelt all the time because we're not assuming that like we're going to crash our cars. But like, what if somebody we don't see hits us? It doesn't mean we're not going to die if we get in a car crash, but at least having the seatbelt minimizes the injury, right? It gives us a chance of living. So my thing is with my patients, when they pay all this money and they have all this trust and expectation, I'm going to do a great job. I'm giving them a seatbelt. It's like one more layer of protection. I'm putting this implant precisely where I want, and then I'm securing it where I want. I've got this sheet, like this mesh, holding the implant and the skin and soft tissue where I want it. It's like an internal splint. Like, if you break your arm and the orthopedic surgeon puts a rod in there that holds your arm in place, like that's metal. It should be good, but they still put you in a cast because the soft tissue has to heal along with the bone, right? So you have to respect the soft tissue. So this works like an internal splint. And then, so it's there while you need it, gone when you don't. And it also allows me to put in like bigger implants, or like when I'm doing a lift, it takes pressure off the skin. So the scars end up looking finer. They're very thin. If you look at people who've had heart surgery, their sternal bone's right there in the middle and it like pushes the scar apart. It forms a callus because it doesn't want to rip open. Well, the breast scars with a lift end up looking a lot better when you have mesh. And that's actually another thing that I ended up publishing about was we looked at the scar quality with the mesh, and it found that even in people with darker skin tones, it was even more protective than not having mesh. So I think it's such a great protection for people's investment, and it allows me to be more precise. So it's a way I've set myself apart. Instead of trying to do cheaper surgery, I'm like, dude, you're getting a better value for the money with what I include,
Yeah, I love that. I am a big fan of mesh. So I'm super excited we got to talk about it today. And we can also talk about, how do you usually on a consult decide where you're going to put your implant? Do you always put your implants in the same place, like underneath the muscle or above the muscle, or dual plane? How do you decide?
So, that's funny. I was going to joke and say, some people are above the muscle, some are below. I'm in between. I do dual plane.
Hey.
The reality is like when you cut the muscle actually window shades up. So if you try to suture the muscle down to have total muscular coverage, you're really getting a flat breast that doesn't have good cleavage in the middle. With the dual plane, you get better lower and medial pull expansion of the breast. So that gives that beautiful cleavage line. And because I'm using mesh in everyone, I am getting like total implant coverage with tissue. I've got the mesh, which is like a synthetic tissue, right? Kind of. And then I've got the muscle. And I like to go into the muscle because my patients are all pretty lean. And even if they're not, they might become lean when they're older, or as we get older, we get leaner. So I like the dual plane because it decreases the chances of rippling, lowers the chance of capsular contracture. So that's what I do. And also, it makes the implants look less like a ball in a sock, which, even if people want like fake looking breasts, they don't want like something that looks abnormal. So I'm pretty much a dual plane guy. Now, if I'm doing a revision on someone and they've got thick, soft tissue or they're a little bit less healthy, their implants are already on top of the muscle. If I can use that pocket and get them the look they want, I don't need to reinvent the wheel in that situation if it doesn't need to be. But a lot of times I do have to convert them to under the muscle.
That's awesome. Okay. And when you are choosing your implant, do you have are you saline or silicone? Do you let the patients choose? How do you decide what implant to go with?
So I have not used saline for about 9.5 years.
You'd be surprised. I thought everybody was doing silicone, but I
Yeah.
see a lot of people with saline.
So saline's awesome. So saline, there's things you can do with saline. First of all, you can make a little pocket, you just put in there, it just expands. They look really awesome in the very beginning. The thing about saline is I think they're heavier. They tend to stretch. And then like that 10-year rule, I think really came from saline implants because what happened was silicone implants got taken off the market for like safety concerns back like in, I don't know, the 90s and stuff. And then we were using saline all the time. And then so in 2006, silicone came back and we knew that 1/3 of saline implants rupture within 10 years. So the recession hit in 2007 and 2008. So all these plastic surgeons would be at parties and go, oh my God, you have saline implants, they're 10 years old. Oh man, they're going to rupture. You need to get the new silicone implants. So it was a great marketing thing. But the reality is that, I don't like saline because they're not as durable. They tend to ripple and wrinkle more. They stretch. They put pressure on the soft tissue. The silicone implants are what we call the new silicone implants that people call the gummy implants, have a more form stable gel. The gel maintains its shape. They actually came from the shaped implants, which were the original gummy implants, and they put them in a round implant. And so these patients who get breast augmentations, they don't want to lose upper pole volume. So they just get that push-up bra look without a push-up bra. So I love silicone. I do have some colleagues that do more saline, but that tends to be for the people that like want a 1500 cc implant, and so like the largest silicone they make is 800. And by the way, saline tends to look a little bit bigger than silicone, like cc per cc. So like a 400 cc saline can look like a 500 cc silicone. So, but those people tend to be like in like the porn industry and other stuff. And I've actually had people come to me who are like
Adult entertainment.
Yeah, exactly. That industry. And they're, they go, yeah, I want 1200 cc's. And I go, look, that's fine. But remember that the largest implant was designed to be 800 cc's. You're overfilling. So the chances of you popping are even greater than if if you just use a saline that's 800 cc's. And I said, do you really want to like guarantee you're going to need another surgery for, sometime in the next 10 years? And they look at me and they go, gosh, not really. Like I've got one right now that just said she originally wanted me to give her overfilled salines. And I was like, okay, cool. I could do that. It doesn't take much skill. And then she said, I don't like the idea of saline. I put my, I'm 26 years old. I've had 4 surgeries. She's like, I don't want to put my body through this anymore. Can you just give me the Rolls Royce? Just, do a lift. I didn't want one before, but like my skin stretched out. Just do a lift, change out my implants. Just give me something I can live with for like 30, 40 years. I said,
sure. Get me through.
Yeah, totally. And by the way, there are some implants that are being studied that they're trying to get silicone implants that are bigger than 800 cc's. So I know Mentor, who's in Texas. I think you're in Texas, right?
Mm-hmm.
So
I'm in Texas.
Yeah. So big butts, no lies. They're gonna have like big implants, no lies too.
Yeah.
I think they've got some implants that they're testing that are higher, but originally designed for people for reconstruction. But when you think about someone who's had overfilled saline implants, has had multiple augmentations, it really is like a reconstruction trying to get them back to the shape they want. And then the largest implant company in the world right now is called Motiva, and they do have some. They can give you custom implants, but they have silicone implants that are a little bigger than 800 cc's, and but they're not available in the U.S. yet. They're going through FDA trials and stuff, but they have the largest distribution of implants worldwide, but they're not even approved yet in America and Canada. So, but on the Instagram and stuff, like their largest following is the U.S. So
Interesting.
yeah, so I'm hoping they get approved in the US because I think they've got some really neat products, and I think it's going to be like give us even more, things that like look forward to for our patients.
That's awesome. So, Dr. Kelshadi, I also have another question that I asked my surgeons.
Sure.
So, drain or no drain for your tummy tucks? Are you drain or drain? Are you team
I
drain?
use great. So look,
Good.
I'm like Mr. Cutting Edge, and like, I'm trying to be innovative, but sometimes old school is good school. I use drains with my tummy tucks. I'll tell you why. I just don't like going to bed and going, oh man, should I have used a drain? Should I have not? I've had some people just make more fluid than I would ever expect, even on a really skinny person with a tight closure. The other thing is the people who do the drainless technique, they're using these things called progressive tension sutures, which are great, but it adds more time to surgery. Then it creates little indentations in the skin, which the patient has to sit there and hope they go away over 3 to 6 months. And it's just a lot of hand holding. But even with all that, there's a 30% seroma rate. I mean, when I think about like the added operating room time, the extra cost, the increased chance of maybe getting a blood clot, and then maybe getting a dimple you don't like, and then on top of that, a 30% chance of having to stick needles in your belly for like a month or two, it's not worth it to me. I just don't have any patience for that,
I agree. I'm team drain. My girls know I'm team drain. Get it. Just use the drain, leave it in there until it's ready to come out, and then you're done with it.
And it makes the surgery quicker. I mean, look, like a lot of times I'm not just doing a tummy tuck. I'm doing like a Brazilian butt lift, where I'm doing liposuction all around, putting fat in the butt. I'm turning them over. I'm taking out their old implants, putting new ones in, putting in mesh, doing a lift, and then I'm doing a tummy tuck. I mean, I don't want to spend the extra 30 minutes. It's already like an 8-hour surgery. Like I don't need it to be 8.5 hours or 9 hours,
Yeah.
So I'm a big fan. Now in the breast, I don't use drains hardly ever. The only time I use drains is like if they've got old silicone implants that ruptured, and I know that like when I do a total capsulectomy, it causes a lot of inflammation, or if they've got like really thick calcified scar tissue, and I got to remove their capsule, which is a capsulectomy. So, but I mean, in the breast, I've got that one down to a science. I don't need drains, but the belly, yes, tummy tucks always get drains.
Awesome. So whoever's keeping count for us on our one of our listeners is keeping count. So Dr. Kelshadi is team drains.
Yep, that's right.
And actually something we talked about on our last when you and I talked the first time, I recently went and had it done. So I want to talk about it today. And if you have a chance,
Sure.
we can talk about the hormone optimization. So I know you offer it at your practice, BioT.
Yeah.
And I'd love for you to tell my listeners about it.
Sure.
How you found it.
So, again, I think old school is good school, but not in this case, but like I was taught, in US medical schools, and they're very conservative. And so we were always told like, steroids and hormones, they cause people to die and heart attacks, and they're not good for you and this and that. And I started first kind of hearing about it, like one of our cardiac surgeons, whenever the male patients would get heart surgery, he'd put them on testosterone afterwards. I'm like, dude, is he crazy? They just had a heart attack, But then I think like it really elevated the mood of his patients and it made them recover faster. So it kind of made sense, So anyways, then fast forward to like years later, I get married. My wife's a pharmacist, and her mom had started like a compounding pharmacy in Orange County here in California. So they were treating all these like perimenopausal women, and they were all these women that loved them because like, they were angry and, having hot flashes and feeling chubby and all this other stuff. And then hormones got optimized, and now they've got sex drive. They sleep better. Their memory's good. So my mind got open to this. And so like, there's these people that I do this amazing surgery. They look great, but they're like, they don't, they're not interested in like letting anyone play with their body, or whatever. Or like I treat the women and they feeling sexy, but the husbands are like, tired and they work a lot and life is busy. So I actually managed to pull my wife to work with me in the practice. And what's really neat is like I'm one of the only plastic surgery offices that I know of that like all your medications you get through my practice. So I'm able to dispense through my office. But what's really neat is she gets to also counsel them on like other medications they're on and stuff. But then it's not just about looking good, it's about feeling good. So we actually will run like a full hormone and micronutrient panel. So sometimes it's not the hormones that are off. It could be your vitamin D levels are low. Like we know vitamin D is important for fighting COVID or like making your immune system better or to make sex hormones. Vitamin B12, like we have a methylated B12, which helps not just with energy, but you can take the pill and it crosses the blood-brain barrier. So it actually affects the way the brain works too, which is cool. But yes, hormone replacement is huge. Women actually make more testosterone than they make estrogen and progesterone. So like some of the younger women, like, they might have normal periods and all that kind of stuff, but like their sex drive is low. Their mood is not like totally stable or they're feeling down. Sometimes like just optimizing their testosterone level to a little bit higher. I mean, as a woman, you're expected to have nothing, right? Because, you're not a man, but like you're supposed to have some testosterone. So I think it's good to help them. For the men, I don't know what's happened with the food we eat and like the world, but like the baby boomers, like the 80-year-old guys, when they were 40, their testosterone levels were like twice what the 40-year-olds today have.
What?
Just the way it is. Yeah. So we found that it's really helped a lot of people. It's been fantastic. There's so many ways that like all this stuff really helps with people's overall health and stuff. It's just good to kind of know where you're at with things.
Yeah, I love it. So I'll tell my girls real quick how I even got started on BioT. So BioT is a hormone optimization treatment. So it's a procedure that you can have done by a provider. So I had it done for the first time maybe like 3 years ago, and it was I didn't even realize that what was going on. When somebody is coming into the practice, like I'm telling y'all, this is how it happens. Like they're bringing something new to the practice. We're all going to try it. We're all going to try it. So we're all getting our labs drawn, and my testosterone was, I don't know, like 17 or something like that. It was super low. And I was like, well, I don't really feel bad, or I don't really feel like anything. I was like, I don't need it. But I had it done because I was low. And then I realized, oh, I do need this. I feel completely different. And let me tell y'all when it happened for me. And before I had BioT done, before I had my testosterone, my hormone optimized, I would go into the nail salon and it could take me like 30 minutes to decide what color to get on my nails. Like indecisiveness, like just I could not make a decision, period. After getting my hormones and getting my BioT, my testosterone, I walk in there and I'm already knowing what color before I sit down, before I even walk up. I already know that's it, done. Pick the color, I'm in and out. I was able to make decisions faster. I felt better. Overall, 10 out of 10. I'm never getting off.
Yeah, it's amazing. Look, I mean, the thing is, so like some of the things that we worry about would be, for example, like in men, we go, oh, it causes prostate cancer. Well, like 18-year-old men have, really high testosterone levels, like 800, 900. They're not getting prostate cancer, but, we still measure like their prostate specific antigen to make sure it's not going up. There are some people that think, oh, like it might cause breast cancer or whatever. No, if you've had a breast cancer that's sensitive to hormones, then yes, you don't want to have those hormones being given to you. But everything's got kind of like a rationale. But what's really neat is like, I think with traditional medicine, we're over medicating people, So you take a typical 40-year-old man, I don't have energy, oh, maybe you're depressed. Okay, you're having depression, you have to pay taxes, whatever, blah, blah, blah. So, okay, we're gonna put you on an antidepressant. Well, now like they don't, their sex drive is okay, so we're gonna give you Viagra. Okay, so like now they have Viagra. Then the antidepressant, they're tired during the day. So now we're gonna give you some Adderall so you're a little bit more awake. Oh, but then I have trouble sleeping enough. So now we're gonna give you sleeping pills. So now you're like, but then like with all these medications you're on, Now your blood pressure is high. So now we got to give you a blood pressure medicine. I literally have a person like this, and he thought he had anxiety, and like all these other things. And literally he was on 5 different medications for all these symptoms I just described. And we got his like testosterone levels like up like really high. And he's like off all these medications. His blood pressure's better, he's sleeping better, and like he's not medicated anymore. So it is pretty crazy how it does. Now, I've got other people that we optimize their hormones, but they sleep 4 hours a night and they're, going through major stress in life. Look, the hormones aren't like a magic pill. I mean, you still have to sleep, you still have to take care of yourself, and if mentally like you're not a happy person and you're a Debbie Downer, like regardless, then the hormones aren't going to change the way you think. So the mind's a powerful thing.
They might need ayahuasca.
Yeah, exactly.
They might need something else.
Yeah, like bruise juice isn't going to help those folks if their brain's messed up. But
that's right.
For my, I've been loving that product, by the way. Thank you for sending me some. For like the people after like our tummy tucks and our body contouring stuff. It's been great. I guess I could put some like where we put the pellets for the hormones. But so,
Thank you. Yeah. I'm so glad you like it. I'm so glad you guys like it.
Such a cool name too. Now, do you recommend like they use it twice a day or 3 times a day or?
So I recommend for them to use it twice a day. Twice a day helps. You really don't need that much. You need just a dab, enough to get a nice thin layer on the area that you're massaging. Massage it in. And by like 3-4 days, you'll start seeing a big difference. You'll see a big difference by then.
Oh, my patients love it. So that's cool.
I'm glad. I'm so excited. Well, I'm so happy I had you on today, Dr. Kelishadi. Tell my girls where they can find you.
Sure. So, my initials are SSK, like S like, Sean, and S like Sean Kelishadi. So you can go to sskplasticsurgery.com, or on Instagram is like where my patients send me their pictures, and I'm basically talking about like what I'm doing, a lot of cars and cleavage kind of stuff. So it's at, and then SSK Plastic Surge, like SURG. Okay, and you got to type in the whole thing because Instagram tends to like try to keep the kids and stuff away from my account because there's a lot of boobs and stuff on it. So you have to type up the whole thing before you see it.
SSK Plastic Surge.
Yep.
All right. On IG, I'll be tagging you in this episode and all of our content from this episode. It was awesome. Thank you so much for sharing so much information with us. And I will see you guys next week.
I love chatting with you, by the way. You have like the nicest.
Thank you. Thank you. Thank you so much.
Thanks for having me. It's always a pleasure chatting with you. Thanks, Mavi. Appreciate it.
Bye.
Take care. Bye-bye.
If you enjoyed this episode, please go on Apple, write me a review. It's the best way for other women who are just like you, who need help, who are looking for information, valuable information on the internet. This is how they're going to find it. So go on Apple, give me a 5-star review if you love this podcast. If you want to support the podcast, the best way to support the podcast is through the website. If you need help through your journey, if you need help finding a surgeon, if you want to join the membership, if you're looking for bruise juice, you guys don't sleep on bruise juice. Y'all know I have my Bruise Juice 30 coupon code for y'all to use if you're having a BBL, if you're having liposuction, if you're having a tummy tuck, if you need to be using Bruise Juice all over your body. Stop using those other brands that are not tailored for your post-op recovery. Bruise Juice is formulated for your recovery. It's amazing. It nourishes your skin. It helps your fat transfer live. Don't sleep on Bruise Juice. Bruise Juice 30 is the code.
And don't forget, new episodes every Monday. I'll see you then.